Thank you for joining our webinar on empowering patients with iPads, highlighting JAMP's solution partner, HatchMed. I'm Brian, and I am the solution partner manager for the healthcare space at JAMP, and we'll be joined by two of our partners, Brian and Kirill from HatchMed, and looking forward to sharing a little bit more about how we're working together to improve that patient experience. So today we'll be talking about why health systems are deploying iPads to improve patient experience, how to use Jamf and Apple to simplify the iPad and Apple TV deployments, and how Jamf's partner HatchMed is helping improve outcomes in communication and patient experience. And again, throughout, please submit your questions in the Q&A chat section because we're here live to answer your questions. For those of you who aren't familiar with Jamf, we help organizations succeed with Apple. We've been focused on Apple device management for over 17 years, and we embrace the native Apple technology experience consumers have come to know and love, and we have offered zero data support for Apple releases for over a decade, supporting new versions and features better and faster than anyone. And Jamf has everything required to manage and secure your Apple ecosystems. According to US News and World Report of 2021 to 22, we're in 8 of the top 10 children's hospitals and 13 of the top 20 US adult hospitals. And one of the reasons, as I said, we have the ability to offer zero-day support. So your security team is no longer knocking on your door asking when you're going to update your apps, when you're going to update your systems. We're here to make sure that you are able to do everything you need right away. And as each of your organizations are focused on how to provide and secure the best devices, Jamf exceeds your needs and can ease the burden of hands-on IT support. And we have solutions for all healthcare organizations in management and security. And we've taken a step further and believe that we have the best suite of tools available for healthcare organizations to exceed at managing and securing their devices. Whether you're a large enterprise organization or a smaller health system, we'll help you with tools for account authentication, privacy, security, and literally going down into the weeds of healthcare. And how do we look at healthcare, the patient experience, clinical communications, and telehealth? The Jamf healthcare team focuses on these 3 main pillars. In today's webinar, we're going to highlight ways to improve your patient experience. And how do we use these tools and the functionality to deploy in-room Apple devices to allow care providers to virtually round on their patients, to ensure patients can use those devices to stay connected with their communities, and have no fear that their information is wiped digitally from the device after they leave the hospital. So why Apple? Let's look at a few recent use case stories and how they used iPads to change the way their care was provided and supported for. Jamf, alongside another solution partner, BeagleBox, a Brightfish company, were able to deploy iPads at the bedside with 2 hospitals across 2 different locations in the south of Netherlands to over 1,000 beds. Zuiderland had bedside terminals with obsolete functionality. They came to us wanting to future-proof and modernize their environment while improving the patient experience. The end result? BeagleBox was able, alongside Jamf, to offer the Zuiderland health system a fully managed iPad with an all-inclusive lease and a way to provide in-room iPads to allow for infotainment, patient care, education, and communication. At UHB Charity, during the pandemic, they deployed over 350 iPads across 4 health systems for the use of virtual visits. Their leadership team was sensing a fear and isolation that was hindering patients and their communities. And iPads were selected as they're fairly simple to use for people who may not have a lot of technological savvy. It began as a pilot, 25 devices that quickly ramped up to over 350 being available at each of the bedsides. End result was a positive impact, and it was immediately seen, with a great story of a gentleman who was in his late 70s who hadn't spent time away from his wife and was able to use virtual visits to communicate with his wife each night that they were apart until they were reunited happily. Geisinger Health has deployed over 11,000 Apple mobile devices for patients and their providers. The iPad at the bedside is utilized for Epic MyChart, iPad language interpretation, telemedicine, and other telehealth features, utilizing virtual visits powered by Jamf. Their VP for telehealth, David Fletcher, provided a quote and indicated that the growth in telehealth technology over the past several months has allowed our providers to connect with patients while minimizing physical contact during the COVID-19 pandemic. We anticipate that telehealth will continue to be an important part of Geisinger's healthcare model beyond the current pandemic. And we continue to hear and see these stories. As we look at different ways that individuals and health systems are caring for their communities, their populations, their patients, UVA Health was able to see an 8-day reduction in the length of stay for neonatal patients, 40% reduction in post-discharge ER admissions, 65% reduction in G-tube usage, and a 0.8% at-home mortality rate versus 5% as a national average, sending the patients home earlier to begin the bonding process, to begin the family unit, to share that love while using an iPad that keeps them in touch regularly with their clinical team at UVA Health. And lastly, UC San Diego Health. UC San Diego was able, as they were modernizing their tower, to reimagine the experience of how to use the Apple platform there. Everything from iPads at the bedside for the patients to deploying Apple TVs to allow for infotainment, education, digital signage. And as they're working with their clinicians, being able to AirPlay results, be able to utilize some of the built-in technologies that Apple offers to improve that communication. And those care team members each being issued an iPhone for shared communication, secure text messaging, barcode medication administration, and workflow improvements, alongside the availability of Apple platform and products. So as you can see, there's a wealth of ways that the technology is able to be deployed. So you've heard the what and the why, but how do we do this? How are we simplifying iPads and Apple TV deployments? It's as easy as this. iPad at the bedside for education and engagement. Let's see what it looks like. With all of these tools in place, we can make sure your whole staff has the right apps and the right kind of security, while it also opens up the ability to hand a device to a patient with a totally different set of rules. We can put apps that grant them access to their medical record, allow them to control the temperatures or drapes from the bed, have video calls with loved ones, and because we can remotely wipe the device after a patient is discharged with our EMR integrations, we can assure that patient data is destroyed. So let's look at what it looks like for an iPad setup from scratch. Patient's admitted and given a clean iPad. With the MDM, you can pre-configure and only have to go through just a handful of settings. So we select our language, the country, the Wi-Fi. The iPad is instantly setting up the appropriate applications that your health system determined should be on that device. And you can even make sure they know who it belongs to. What the patient sees, different things like their EMR apps. If you have an EMR that has a bedside application, that patient can have real-time insights into their medical info, schedule, their care team, vital signs, and much more. This allows for better communication and understanding. And some hospitals have been able to go above and beyond with this journey, extending the self-serve concept to the room and environment itself. For example, UC San Diego Health that I was speaking about has deployed a custom Crestron solution which provides an iPad app to control room temp, lights, blinds, and even the television. Jamf worked with our solution partner to make this happen and helped Crestron build support for Apple's managed app config framework within the MDM. This allows Jamf to pre-configure this app for each room as it's deployed, ensuring that a patient has access to only their room, not their neighbors. And managed app config, it means IT predefines certain variables, key values to that app. In this case, the room number. It ensures the iPad only controls the room that I'm in. Apps commonly interpret the following things: server URLs, ports, user configurations like usernames and emails, and we can help you set the values for all of that. HatchMed we'll get into. We're going to talk about their hall monitor, their pillowcase speaker, and the way that they have Concierge, their app that allows for app config support. And when the patient discharges, we've got that connection with healthcare listeners, so the iPad is wirelessly wiped by Jamf automatically and digitally sterilized for the next patient. No carts or plugins or anything else needed, no IT support or clinicians making sure that they're touching the devices. As you see, it's doing its magic and it's ready for our next patient. The healthcare listener is an EMR integration. It just takes the ADT information over the air, and soon the process can be further enhanced with our app refresh launch, so stay tuned for more information. So we're talking about iPads, but how do we take it even further? As your organization is looking for solutions for digital signage, ways to take the iPads and be able to use them for improved communication, many health systems are taking advantage of modernizing their environment and using the digital signage, the AirPlay from iPads for patient engagement, which have really resulted in how we can use the full Apple suite. With Apple TV, it's really the end of manual, time-consuming setup. Organizations are already deploying, configuring, and leveraging Apple TV for a wealth of use cases. And here's what Apple has done to make it better, and what has allowed Jamf to offer a fully centralized Apple TV management solution. From zero-touch setup, to over-the-air configuration, to enterprise app deployment, remote commands, tvOS restrictions, you can save measurable amounts of time, money, and resources on an Apple TV deployment. So let me show you how simple it is. It goes like this. As you're unboxing, the setup process is easy. Simply connect the Apple TV to power and Ethernet. Remember, it needs to be a 4th gen, DEP eligible. But as the device just turned on, you'll see a brief period it let you set up or pair a Siri remote. Then after about 30 seconds, the Apple TV automatically walks through the process of deploying the appropriate apps, setting up screens, quickly enrolling in Jamf Pro, and voila, it's ready to go. As we look at mass TV to iOS device pairing, we've built this feature to solve a problem for organizations with large group of Apple TVs and iOS devices, such as yourselves in hospitals. With new AirPlay permission settings and enhancements, you can use device details like room number or floor or other inventory information to customize an extension attribute to create a relationship between each Apple TV and the associated iOS devices. So what does that mean? Jamf customers can define this relationship. In settings, as you'll see on the right side, global management, with one simple setting, you can define which Apple TV will be available for AirPlay pairing with another iOS device. The benefit for your patients? It's huge. Since you control what they see, it doesn't bog down the iOS device with every single Apple TV in your organization. Because we don't want patient in room 5 to be AirPlaying to room 10. One of the biggest use cases in healthcare, but this can work with any other organization. Dream big for how you can solve this problem. And if you have pediatric units or a pediatric hospital, we also have another way to help solve for what is available and making sure that the right person is seeing the right thing. Jamf Parent for Patient Bedside. Jamf Parent for Patient Bedside allows the parent to manage what that iPad can and can't see, not the health system. So let's see how it looks. In Jamf Pro, the parent will have an app that they can use on their personal device to allow what is and isn't available. And when that patient is discharged home, it'll automatically withdraw any information and clear that device. Just as simple as this. Open the self-service app. In that top right corner, you tap Jamf Parent icon. The parent scans a QR code. On their personal device, iOS or Android, they can select what app categories are available. They tap that green button to scan the QR code, and there's no step 3. When it's time for their loved one to go home, the Revoke management processes this. The parent app capabilities are ended as soon as that iPad is wiped, whether it be with the healthcare listener or Jamf reset. So we've talked about the why, the how. Let's talk about one of our partners in improving communications and patient outcomes with HatchMed. Kirill, handing it over to you, sir.
Thanks, Brianne. So, as mentioned, my name is Kirill, and I oversee the product side here at HatchMed. And I'm excited to give you a brief little overview of what we've been doing with iPads, both on the hardware and software side in collaboration with Jamf for the last couple of years. So we're, as all of you know, super impressed by what hospitals have been doing with iPads ever since they really, over the last couple of years, have started adopting them more and more, whether it's entertainment, education, calling their family members, really anything is possible. And we think that there's so much more that an iPad can do, and including becoming almost a clinical device in a hospital room. And we think that that's, once it becomes that, and once it really becomes something that is more to an average hospital than just a luxury item or maybe an add-on for a patient, but instead really a way for a patient to interact, control, and sort of digitize their experience, if you will, while they are in the hospital. And we're a little bit biased on that front because long before we did anything that related to iPads or tablets in general, we actually started off by making magnetic cables. And specifically, we magnetized that connection between the hospital bed and the nurse call system, which is traditionally a kind of printer cable looking 37-pin connection. And what happens often is that either that's just not plugged in at all, or maybe it's plugged in but some of the pins are bent, or maybe the jack is damaged because the bed will get pulled away and may damage the cable or the wall. And what happens, unfortunately, is that a patient may be in bed and they may be hitting the red button on their bed rail. They may even be trying to get out of bed, and their care team won't be notified. They won't know that there's a bed exit going on. They won't know that their patient is calling for them. And having a simpler magnetic connection really helps improve communication between the patient and the care team. And since we started that, we also did a similar approach for the pillow speakers. And really only around 2 to 3 years ago is when we first got into mounting iPads in front of patients. So this right here was actually our first project of putting a lockable clamp onto essentially any hospital stretcher rail with an iPad on a gooseneck. And it was the easiest, simplest, and really the only way still to quickly put an iPad onto any rail and display it for the patient. And since then, we've done a similar thing for the bed, for the wall arm, for the overbed table. So really, we've been doing hardware for displaying iPads and making iPads sort of more interactive and easier to use for many years now. And in our experience, whenever a hospital is looking at buying or getting into tablets, there's kind of three main areas that they need to consider. So first is obviously the device itself. Now, we are iPad exclusive with what we're doing, and we're super excited to be working with Jamf and a lot of the cool workflows and possibilities on the ecosystem side that we've been able to unlock thanks to Jamf. And once that device is chosen, usually the hospital, the next big step for them is picking which software they're going to run on that iPad, whether it's simply for content, providing content to their patients, whether it's using it to call their doctor or call their family member while they're in their room, or if it's connecting it to their EMR or doing patient engagement. That really usually is the driver we find behind a lot of iPad purchasing decisions. And lastly, and almost from our experience, hardware is kind of the afterthought when it comes to buying and deploying iPads, unfortunately. And what happens is a hospital may have a great commitment, great plan, great use case for devices, but if they're either difficult to use or they take a lot of upkeep from the care team, whether it's charging, hot swapping, cleaning, making sure that the charging bricks don't go stolen, there's really a variety of ways where a less than ideal hardware execution can really kind of detract from the utility and from the usage of iPads. And our experience and really our bread and butter is providing that hardware to make sure that the iPad can be at its best. And the fourth point, which is really missing on this triangle, but from our experience and from everything we've seen, is kind of how do you connect this new iPad with the software, with the hardware, into the existing nurse call system. That's kind of how we think about it, where it's how do you make this iPad a clinical device, and how do you make this more than just a content delivery device, but instead something that the patient can interact with to control their stay, to help them get out of the hospital sooner, and still have all the benefits and the advantages of an iPad in terms of ease of use, nice screen, and just a very, very clean and simple way of delivering entertainment and content to them. So the way that we do that is through a couple different ways. And we have two hardware solutions, which are the pillowcase. That's a handheld case for the iPad that the patient will hold it in. And we have the hall monitor, which is a digital door sign that we would put outside of the hospital room. And lastly, we have Concierge, which is the software that really ties everything together. That's our iOS ecosystem on the back end that really makes sure that everything works well and talks to each other, and really is a plug-and-play, simple-to-use solution from the App Store. So pillowcase is, as mentioned, an iPad case really at its core, and because it has that red button in the corner, and it's UL 1069, what that means is that red button is actually the same standard and the same functionality wise as a red button on a pillow speaker, red button on a side rail, and a patient can really be watching a movie, they can be doing anything you want on their device, and at any time they can click that red button and immediately contact their nurse. So really, it's a very safe red button, and if the iPad's unplugged, if the cord is disconnected, that red button will also turn off. So they're not pressing or clicking buttons that may not work or may not actually be connecting them to their care team. And we do this connection for a couple different iPads. We've done a pillowcase for mini, for a larger 10.2. And the really cool part is that working with Jamf and working with the workflows there and the healthcare listener setup allows us to essentially, after a patient is discharged, fully erase the iPad. That's on the Jamf side. Skip a lot of the enrollment steps, which is really one of the main benefits for the hospital, that a patient does not need to, or the care team for the matter, they don't need to play IT. The iPad is easy to set up and they don't have to go through all the steps. And once the iPad is fully set up, provisioned, our app is automatically downloaded onto the iPad. From then, From there, when a patient first opens it, because we have a direct integration with Jamf and with the EMR, we can actually auto log in to our app, so the patient doesn't need to worry about any logins or passwords or anything, and we can actually automatically assign this device to a specific room. So the first time that a patient picks up their device, picks up their iPad, thanks to Jamf, they're going to be immediately greeted with a screen that says, hello, welcome to your stay, and we already know which room they're in, what their preferences are, what their preferred language is, who their care team is, and that's all information that we can just seamlessly pull and display for the patient right on their screen. And what that allows us to do is really make the iPad and the pillowcase a digital pillow speaker. And that's something that's really never been done before. First, because before Jamf, there was no good way of cleanly and easily provisioning an iPad for each patient in a way where it's still custom to the patient. And also, what we've done is we've developed a way to plug this pillowcase essentially into any nurse call system and have it function the same exact way as a pillow speaker would. So there's no need at all for retrofitting all smart TVs. You don't need to change out any of your existing blinds or lights or anything else. Whatever is currently controlled by your pillow speaker, that can be displayed on the screen of the iPad itself. So that's our pillowcase solution. Next up is hall monitor, which again is care team facing, but really still focused about the patient, because everything that is on there is displaying precautions about the patient, whether it's fall risk, containment level, isolation level, and all that is complemented by this illumination on the borders of the device, which is just an easier way to provide more information to a care team member if they're just glancing down the hallway and they want to see, let's say, if patients are being discharged, if there's some precautions about that patient, really. So it's a way to display a lot more information contextually about the patient without having to do Post-it notes or papers on outside of the room. And since there's an iPad inside the room and an iPad outside of the room, both of them are managed by Jamf. And once they're enrolled, signed in, and the patient has been assigned, we can actually do a direct two-way video call seamlessly between the two devices. So they don't need to log into any of their accounts. This is just a really easy way for a nurse to talk to the patient inside the room without having to gown up or get ready, just to check up on them, make sure that they're okay. And again, thanks to Jamf, in between patient visits, we're able to not only erase all the information, but if a nurse does want to walk up and add a manual selection about the patient, whether it's throw up a quick tile, throw up a do not disturb alert, all of that can still automatically be cleaned away and wiped away through the Jamf and Healthcare Listener reset process. And lastly, we have Concierge, which is the software that you've already seen running on that hardware, but it's the what we call our best way of doing a digital pillow speaker. So the beauty, again, with Jamf is that if a patient is issued a hospital-owned device, that Concierge app can already be automatically downloaded on here, configured for the patient and their preferences, their schedule, their language, their care team. And so when they pick it up, it's as intuitive to use as a traditional pillow speaker, if not more, because we can actually add a lot more functionality. And the best part is they can call their nurse, request ice chips. That will all go directly into the nurse call system as it would with a pillow speaker. And then they can easily exit out from that app and do whatever they want to do on their iPad. Really, we believe that an iPad should be used as an iPad, and they should only be looking at our digital pillow speaker solution 1% of the time during their stay. And the rest, they should be playing games, watching movies, really doing everything they can to distract themselves and not make it feel like they're stuck inside of a hospital. And again, thanks to Jamf, all of these settings and configurations we can automatically pull in between visits and really make this a seamless experience for any patient. So